Welcome to the Higher Power Podcast, presented by Higher Power Sports PT, the show dedicated to helping active individuals like you unlock your full potential through expert insights on injury prevention, performance enhancement, and recovery. Kurt Kessler is a board-certified specialist in sports physical therapy and an athletic trainer. In each episode, he and his guests bring you the latest evidence-based strategies to help you move better, feel stronger, and stay injury-free. Let's learn together.
Hey there, everybody. Welcome to another episode of the Higher Powered Podcast. Today's topic is going to be a fun one for me because it's something that I'm passionate about. I'm going to take you to a deeper level on the topic of ankle sprains. A wise man named Drake once said, "Like a sprained ankle, boy, I ain't nothing to play with." I'm going to explain to you why a sprained ankle ain't nothing to play with. So the first topic we'll talk about are just a couple statistics and describing what exactly an ankle sprain is. The first statistic is roughly 2 million people suffer ankle sprains every year. That information is coming from the NIH, and ankle sprains are also the most common injury in sports. I don't think there's much surprise there. A lot of education for athletic training revolves around this because you see it the most. They say that roughly 16 to 40%, depending on the source that you're looking at, 16 to 40% of sports-related injuries are ankle sprains. And we're talking most commonly on the outside of the ankle, but sprain really refers to any ligament surrounding the joints of the ankle. It most commonly happens in sports when you land on someone's foot or you're on uneven surface. Your foot gets caught in the turf, step on uneven ground, and your ankle turns in. I think most people know what I mean by that because it's happened to most of us. Ligaments are a structure that connects bone to another bone, and it provides stability. And when it's injured, what happens is it gets stretched out a little bit. So for all of you seamstresses out there, imagine you're stitching or you're creating clothing, and one of the stitches in the clothing gets stretched a little too far and either stretches out or it tears. So the integrity of that seam is now lessened. It's the same idea with a ligament. If the ligament is put in a position or has more force placed on it than it can handle, then it will stretch or tear. The joint that it is supposed to stabilize then becomes a little loose or a little less stable. It's not able to support that. And then you can get sensations like giving out, more susceptible to rolling it again, and just the overall feeling that it's a little less stable. So what happens after an ankle sprain? Well, what we've seen in research is that there's actually a very strong correlation to weakness in the hip. So more specifically, muscles on the outside of the hip or on the side of the hip called your hip abductors. The job of the hip abductors, the two jobs mainly. One is to move your leg out to the side, and the other is to stabilize your pelvis, most commonly when you're walking or anytime you're in single leg stance. So that muscle, when it's being used in single leg stance, prevents one side of the pelvis from dropping. We'll talk a little bit why that's important in just a minute. Some other things that are commonly seen: dorsiflexion range of motion, or the amount that the front of your ankle can bend. Think about like when you're going up and down the stairs, when your knee goes over your toes, that bend in the ankle is called dorsiflexion. So you can see some range of motion limitations there. And what we call the distal tib fib, or that bone that sticks out on the outside of the ankle, is where your fibula attaches or articulates with the tibia. So that joint can also be affected as well. Big thing that we see is changes in gait mechanics or different loading patterns. And what I mean by that, I won't get too deep in the weeds here because it can become confusing and a little bit overwhelming. But the idea is just that the muscles around the ankle, even up the entire leg for that matter, they just work differently in an attempt to protect the injury, and therefore changes the stresses that are placed on the hip, the knee, the ankle, and the foot. So really that whole leg. Another thing that is often affected with any injury, but specifically ankle, is strength. So we're talking about the foot intrinsic muscles. So all the little muscles that are in your foot or in between the bones of your feet can be affected, muscles of the calf, and then your glutes or the muscles around your butt or your hip. All of those tend to be affected in some way after an ankle sprain. Performance-wise, looking at power is often affected greatly, specifically talking about like jumping or landing and making sure that you can control that landing so that your foot and your knee aren't just, falling all over the place. And tying into that is balance. So all of these things, from range of motion to the way that you walk, strength, power, balance, all these things are very commonly affected after an ankle sprain. And what happens if that goes unaddressed? Looking at some long-term considerations or long-term concerns if it's not addressed. So chronic ankle instability is a big term in the physical therapy world. So what happens with this is you can end up with multiple ankle sprains, continuing to roll that ankle or continuing to sprain that ankle. And that over time leads to changes in your ability to control your posture. Or when people think about posture, they think about sitting up straight, but really posture just means the state that your body is in when it's resting or when it's holding just your body upright in general. A big statistic here: unaddressed ankle sprains, so ankle sprains that are not rehabbed or not rehabbed properly, are 5 times more likely, the people that do this are 5 times more likely to tear their ACL. And this is due to changes in proprioception or that joint's ability to react and know what it's doing or what it needs to do when you're landing, jumping, all of that stuff, and landing mechanics. So going back to the strength deficits or the performance deficits of the hip after the ankle sprain, the muscles around the hip are very important in controlling what the knee does during landing. Or if you're lacking pelvic control or not able to control or stabilize the pelvis when you're landing or cutting or twisting, that then greatly changes the stresses on the knees. So that's why a lot of people will say, well, what does an ankle sprain have to do with tearing your ACL? Well, if it's not addressed, all these things that happen after the fact can put your knee in a worse position, or you're not able to meet the demands of sport that end up resulting in more likely tearing your ACL. And that was found in two separate studies. Along with some chronic ankle instability, what you're looking at is persistent instability. So like I said, just either recurrent ankle sprains, not feeling stable, feeling like it's giving out. Along with that comes degenerative and arthritic changes, chronic tendon inflammation. All these things can limit someone's ability to exercise or limit someone's desire to exercise because they just don't trust it. We mentioned the changes in arthritis and tendon damage. So what ends up happening is all these repetitive stresses and chronic ankle instability then leads to early onset arthritis. So again, with that comes pain, stiffness, and all the things that you hear everyone complain about with arthritis. They say don't get old because, this is a lot of the stuff that they're dealing with. And it's not that it sets in like right away. But, you think about normal onset of arthritis is probably, greater than 55 years of age into the 60-year range. But if these things go unaddressed, that can present as a little bit earlier onset of arthritis. So that's what I mean by that. And the biggest concern for me, or the biggest thing that happens when you're not able to exercise, you're not able to move as well as you should or as well as you need to, comes with concerns about sedentary lifestyle. So if you're not able to exercise, not able to move, you're less likely to do those things, which then comes with all of these secondary concerns that come with a sedentary lifestyle, such as obesity, heart disease, type 2 diabetes, high blood pressure, high cholesterol, increased risk of stroke, certain cancers like colon cancer and breast cancer, osteoporosis, musculoskeletal disorders, depression, anxiety, increased risk of early death. So, this is obviously worst case scenario, but I'm just going to take you through a scenario where this kind of plays out a little bit. And this was a scenario that was presented to me maybe a year or two ago, and it completely changed the way that I looked at and thought about ankle sprains. So here we go. Say you're in your 20s, sometime in your 20s, you have an ankle sprain. You say, it was pretty bad. It was swollen. It was purple, but I'm not going to do anything about it. It's just an ankle sprain. So then you continue to play sports or try to be active. You sustain a second one a year later, a third one a year later, down the road, maybe another one. And this person gets to the point where, it's not worth playing sports anymore. I'm afraid I'm going to get hurt. I play and my ankle just hurts, or it's time for me to give it up. So then they're dealing with ankle pain. They're dealing with some of these changes in the ankle. Again, we talked about early onset arthritis. They get into their 40s, 50s, start noticing some of these things. At some point along the way, maybe they start to have some hip pain or start to have some back pain, and it stops them from exercising. My back just hurts too much to exercise today or this week, or I can't really go through my normal routine because my hip's really bothering me. So what happens when they stop exercising? Well, then they start to gain a little weight, 10, 15 pounds, whatever. And, not exercising, starting to gain weight. Now we're starting to have some cardiovascular, some health issues. My doctor said I have high blood pressure, so I'll just take medication for that. And then we start over time compiling all these different medications for pain or these secondary changes that happen in the body due to not being able to exercise properly. And what happened as one ankle sprain in the 20s turned into 3 or 4 ankle sprains into the 30s, and then stop being active, start having pain. Pain prevents them from being active, stop exercising, and then all these secondary health issues start setting in. And I'm sure there's a group of people out there, a group of people listening that are like, oh, Kurt, why would you say this? You're just fear-mongering. You're taking something so simple as an ankle sprain and you're, telling people they're going to die early because of it. And what I would say to that is I'm not fear-mongering, because I'm not saying there's nothing we can do about it. You sprain your ankle and all of a sudden it's a death sentence. But I would say that I am creating problem awareness to the importance of why we need to not just brush it off as an ankle sprain and address it properly. A couple weeks ago, here's another story. A couple weeks ago, I was in a basketball gym. There was an older gentleman who was coaching, and one of the players had been dealing with an ankle injury. And he said to me, well, back in my day, we just taped it up and played. We played through it, And he had like the old school tough guy mentality. And then later in the conversation, he says how he can't move and started blaming all his old injuries. And I'm just thinking like, well, you can't have it both ways. You can't be tough guy and play through it and then complain that you can't move because of all your old injuries that were never taken care of. So, and the reason why I'm passionate about this topic is because it hits home for me. So let me tell you about my history with my ankle. So I was a freshman going into my freshman year of high school. Was at a basketball camp. I sustained my first ankle sprain coming down from a layup and swelled up really big, size of an orange or grapefruit or whatever, turned purple. And back then, I'm not that old, but even back then, like there just wasn't great information out there about, what to do for it. So what did I do? I stayed at home for 6 weeks in the summer, played video games, whatever, because I couldn't walk very well on it, and just let it heal on its own, no big deal. I went back to sports, didn't really affect my sports career that much, but as I continued to be active, I rolled it here, rolled it there, and over time, it started happening more and more often. I get to the point where I was playing basketball again. It was over a year ago, and it came down, landed on someone's foot. Now, you land on someone's foot, there's not always much you can do about that. The injury is just going to happen, but sustained another major ankle injury and has not quite been right since. So I've noticed these things. Ankle and shoulder are probably my two favorite things to treat and work with. So what I've learned about it in the past year and a half since this happened has really changed the way that I've looked at and the way that I treat ankles. So I'm taking the steps to try to address it, but I've learned that I'm not always the best patient with myself and that I'm much more effective at treating other people than I am treating myself. So it does hit home a little bit. The big thing I want everybody to understand here is that yes, injuries happen. Yes, ankle sprains happen. Yes, all the stuff that I outlined that could happen over the course of a 40-year span because of untreated ankle sprains, they can happen. But there is so much that we can do for it to prevent all of that. So, like I said, it's not a death sentence if you sprain your ankle, but there are things that we can do and reasons why we do these things so that patients don't have to worry about all of these other considerations and can get back to what they want to do, get back to what they love to do, and not worry about either re-injuring or all this other stuff down the line. So what we do for it, we start with a movement screen. So we determine your functional range of motion, basically if your body is able to move through that normal range. If you're not able to, or if you have pain, then we address it. Once we go past that, we look at your gait or the way that you walk, make sure that we get you back to a normal walking pattern to prevent future pain or overuse of certain tendons and tissues that can happen when your gait is altered. We do strength testing and specifically, or most importantly, appropriate loading. What happens or what generally tends to happen after an ankle injury, your brain thinks, okay, it hurts to do this, or when I shift more weight onto my affected side, I get this sensation or whatever. Or even if it's just strength, your brain knows the path of least resistance, the thing that's going to make this movement easier, and it's often shifting weight onto your uninjured side. So if we don't work through that and reintroduce those normal walking patterns again, then that just stays like that, and that affected side never gets the appropriate loading or the proper care to get it strengthened back up to the point where the body's functioning equally on both sides. So we do a strength testing of different muscles and different movements, and then we prescribe specific exercises dosed for what you need to truly gain strength. So what I mean by that is I can tell someone to go do, 3 sets of 10 of this exercise and just have them do 3 sets of 10 forever, but they're never going to progress. They might get good at doing 3 sets of 10, but they might not actually be getting stronger or get more powerful or get more endurance out of those muscles because they're not being specifically trained and specifically retaught how to do those things. Another big thing is restoring balance, both statically or standing in place. So people think about balancing on one leg, but more importantly, dynamically through athletic movements and reintroducing that ankle or that whole leg back to balancing through various movement patterns. We restore power and agility. So power just means the ability to generate force quickly. Think about jumping, cutting, change of direction, looking at sport-specific movements, the things that a wrestler has to do versus a basketball player versus an Olympic weightlifter. So all of those athletes need different things or need their ankle to do different things. So we as sports specialists have the knowledge to implement specific movements depending on the sport. And the overall goal is to restore that limb back to equal to the other side so that, when you squat patterns are equal. When you lunge, when you do all these different functional movements that happen normally throughout your day, that over time, we're not creating any kind of deficits or changes in loading, and that your body can function and move optimally. So the big takeaways from today: ankle sprains are not just ankle sprains. If left untreated, they can lead to significant movement and health challenges. Untreated ankle sprains can increase the risk of future injury, both for that ankle or anywhere really up that leg and into the low back. And the last point is there are a lot of ways that physical therapy and performance physical therapy can help. All the things that I just mentioned can help restore that so that there are no long-term deficits, or we minimize long-term deficits. That's going to do it for today's show. Again, I hope that I was able to open the eyes of the listener here, or open the ears of the listener to what goes through my mind with ankle sprains and why I'm so passionate about making sure that they get the appropriate treatment, because I want people to move, I want people to exercise, I want people to live healthy lives, and I know that I can make a difference and make a change for people who are seeking to stay active and make that a priority. That's going to be it for today's show. Thank you to everybody for listening. As always, if there's any questions or anything that I can help with, please feel free to reach out. Email is in the show notes, or you can connect with me on Instagram at Higher Power Sports PT. All right, have a good day, everybody. Thanks.
That's a wrap for today's episode of the Higher Powered Podcast, presented by Higher Powered Sports PT. We hope you gained valuable insights on how to stay strong, move better, and prevent injury, all backed by expert knowledge in sports physical therapy and athletic training. If you enjoyed today's episode, don't forget to subscribe, rate, and review. Your support helps us bring more evidence-based tips and strategies to active individuals just like you. For more resources or to connect with us, head over to hpsportspt.com. That's hpsportspt.com. Remember, you've got the power to perform at your best. Keep training smarter, recovering faster, and living stronger. Just a reminder that the content shared in this podcast is for informational and entertainment purposes only. It should not be considered medical advice. Always consult with a qualified healthcare professional before making any changes to your health or treatment plan. Thanks for tuning in. We hope to see you next time on the Higher Powered Podcast.